In the years since the COVID pandemic began, there have been around 150 million cases worldwide and over 3 million deaths. No country has escaped the effects of COVID-19, and every country has taken a different approach in navigating the pandemic. Some of those approaches have been more effective than others. Today, we will be taking a closer look at the global effects of this pandemic and how countries beyond the US have responded. As of this recording, COVID is ravaging India, with approximately 350,000 new cases and around 3,000 deaths per day. Severe supply shortages have compromised infection control and patient care. The central government took few steps to contain the outbreak as the second wave of infections arrived. Prime Minister Narendra Modi praised the country's success at fighting COVID, even while hospitals were becoming overwhelmed. Under Modi's administration, many political parties continued holding rallies for thousands of attendees throughout March and April of this year. In Brazil, scientists are struggling to make their voices heard despite the proclamations of President Jair Bolsonaro, who has repeatedly downplayed the severity of COVID-19, spread misinformation about the safety of the vaccines, and refused to wear a mask even after being infected himself. In early 2020, Italy faced a horrific first wave of infections, which led to widespread lockdowns as officials sought to contain the virus. Cases crested again all over the world in late 2020, with death tolls in Italy and the UK higher than anywhere else in Europe. This spring, France is facing its worst surge of infections yet, with intensive care units at capacity and vaccination efforts making only halting progress. Africa has also been severely affected by COVID-19. Across the continent, more than 3 million cases have been reported since the start of the pandemic, but this almost certainly underestimates the true number of cases. Data from Kenya and Nigeria suggests that COVID may be far more prevalent in these countries than existing test data suggests. Testing capacity and healthcare access have presented barriers, especially in isolated areas. Despite these challenges, Rwanda has fared better than many nations and many US states, navigating the pandemic with methods such as pool testing, which involves testing many samples together, and setting up extensive contact tracing by mobilizing community members. Rwanda also implemented strict lockdowns, masking, and social distancing measures, and relied on systems that had previously been set up to address HIV. Other countries also acted quickly to contain COVID-19. Having previously experienced the SARS epidemic, many people living in East Asia were already alert to the risks of respiratory viruses and were prepared to take measures to curb transmission, like masking in public. Although China was the first nation to see COVID cases, case rates were lower there than in many other countries. Strict lockdowns, high testing capacity, and highly effective contact tracing, which was accompanied by stringent surveillance of citizens, all contributed to keeping cases relatively low. China is also one of the world's largest manufacturers of PPE, so it didn't face as many supply shortages as many other countries did. However, China's official case numbers have been questioned, with whistleblowers revealing that COVID cases, particularly early in the pandemic, were going unreported. Dr. Li Wenliang was one of the first doctors to raise warnings about COVID in China when it first appeared. He was warned by police not to spread rumors, but he persisted in sharing information about COVID until he himself died from the disease in February 2020. Dr. Li knew that during pandemics, people need access to clear, accurate information. Good decisions depend on good data, because without it, we don't know what's working well and what's not. Other nations, like New Zealand, Australia, and Singapore, were at an advantage geographically because as islands, it was easier for them to control COVID at their borders. But their evidence-based policies have also helped them keep COVID under control. New Zealand and Australia used what is known as an elimination strategy, where the goal is to bring the incidence of cases to zero in a particular area or region. New Zealand initially lagged in their capacity to provide testing or contact tracing services, but strict lockdown, isolation, and quarantine measures were implemented. Resources, political direction, and cooperation were all necessary for this to succeed. Policies were based on recommendations from public health experts and were vocally supported by political leaders like Prime Minister Jacinda Ardern. This strategy has enabled daily life in New Zealand to return more or less to normal. One important public health principle is that policies need to be tailored to the context they'll be applied in. Before you design a public health response, you need to know what values the community holds and how your response supports or conflicts with those values. Strategies that work in one setting might not be the best in another. For instance, South Korea was very effective in curtailing COVID transmission, in part because the Korean government used extensive surveillance on citizens to ensure that they were complying with requirements. In a culture where privacy and individual freedom of movement are more highly prized, that might not be a trade-off people are willing to make. One intervention that presents a source of hope for controlling COVID worldwide is vaccination. But if higher-income countries control the supply of vaccines and keep them for themselves, lower-income countries will see COVID continue to spread, and new, potentially more dangerous variants will have more chances to emerge. This would continue to endanger not just countries with limited vaccine access, but also the entire world, since the emergence of new variants could make existing vaccines less effective. Ensuring that vaccines are available equitably worldwide is the goal of COVAX, an international COVID vaccine allocation plan led by the WHO and global health NGOs. COVAX has brought together countries all over the world to collaborate on the development and distribution of vaccines, and has procured hundreds of millions of doses of the AstraZeneca vaccine and over 1 million doses of the Pfizer vaccine for global distribution. However, wealthy countries have bought up large reserves of vaccine, leaving little behind for poorer countries. Equity has also been a concern within countries. Israel has successfully vaccinated a record proportion of its population, but has received criticism for initially not offering vaccines to all Palestinians who work there. Because transporting and storing vaccines relies on infrastructure like roads and refrigeration, distributing vaccine to the most remote parts of the world is a difficult undertaking, leaving many areas vulnerable. Prompted by the explosion of cases in India, the US has finally agreed to provide some of its stockpile doses of the AstraZeneca vaccine, and to provide India with materials for vaccine manufacturing. Many advocates are pushing to lift patent protections on COVID-19 vaccines so that they can be manufactured more easily and cheaply, and made more widely available across the world. However, even if these patent protections are lifted, mRNA vaccines in particular require specialized technology to manufacture, and that might make it difficult for them to be manufactured in more places. As more people are vaccinated, some countries are requiring proof of COVID-19 vaccination for travel and immigration. Vaccine passports are not new. People who travel internationally have long been required to offer proof of vaccination to certain diseases when they're traveling to and from certain countries. But with COVID-19, vaccine access is currently highly variable from country to country, meaning that vaccine passports could be used to discriminate against immigrants from low-income countries, while only people from rich countries with ample vaccine access would have freedom of movement. Still, travel is an opportunity for disease transmission, and vaccine passports can help prevent travel and immigration-related outbreaks. The best solution for the potential inequities that could result is to make sure that COVID vaccines are cheap and accessible all over the world. The pandemic has ravaged and changed our world like never before. Different countries have different contexts and needs, and public health approaches need to adapt to those differences. But every strong pandemic response needs to be rooted in evidence and supported by adequate resources. In a worldwide public health crisis like this one, it's clearer than ever that as a global community, we need to make sure we invest in public health basics and in scientific research, and that we recognize that when it comes to contagious diseases, to protect anyone, we have to protect everyone.